And let's begin this broadcast by getting you the latest updates from the city of Mumbai. Much like what we saw in the first wave, in the second wave, it again has begun with Mumbai recording a huge surge in the number of COVID cases. Over 2,500 cases have been reported in the last 24 hours. That's the biggest COVID spike that we're seeing in Mumbai in the last 7 months. 2,510 fresh COVID infections, to be exact, have been reported on Wednesday, along with one death. Maharashtra remains the worst hit state, with the Omicron tally now climbing to 252. That's a staggering jump of 300% in its tally on Monday. A fear of third wave looms large over Maharashtra. The state government has, of course, already imposed very strict curbs. Citizens in its latest advisory have been told to stay at home and celebrate New Year. No parties, no large gatherings are allowed in the wake of rising cases. Citizens above 60 years and below 10 years are suggested not to step out of their home unless absolutely necessary. The state government has also asked citizens not to crowd famous tourist spots like the Gateway of India. The only ray of hope for the state government is that the COVID fatality count hasn't gone up. There's been no jump really in the reported hospitalization numbers. So far, while there is a spread and it's spreading very, very fast, the COVID cases and patients haven't reported any fatal infections. And Rajdeep Sardesai spoke exclusively to Dr. Shashank Joshi, who's part of the COVID task force, on Mumbai's Omicron surge and whether the third wave has already hit us.
Dr. Joshi, you're at the heart of it. Mumbai registering more than 2,000 cases in the last 24 hours. Is this cause for worry, or are you optimistic because hospitalizations remain low?
This is a cause for concern and caution. There is no need to panic. Clearly 2,500 cases. Look at the doubling time. In the doubling time has been only 4 days. From 600 cases to 1,330 plus cases yesterday, and from 1,330 to 2,500 cases today. So, and all cases are mild and hospital infrastructure is not at all dented. Which means indirectly, even without a genomic sequencing, the Delta has been in Mumbai more than 80% replaced by Omicron. No question asked about it. It is a clear-cut diagnosis there. And therefore, Omicron is a milder strain. Hospitalizations are less, severe disease is less, mortality is less. And let us hope and pray that the entire Delta is fully replaced by Omicron, which is a milder disease. Only thing is the numbers are huge and we can still dent it.
But can I get clarity, doctor, from you? You're telling me that this rise is driven largely by Omicron, even without the genome sequencing? You're telling me that?
Absolutely. Because if you have 2 times doubling going up in a span of such a short duration of 4 to 5 days, the data is overwhelming and clear-cut that this is Omicron. So I can bet my last bet on it that when they do the genome sequencing, 80% or more will be Omicron. There is no question asked. This is a clinical diagnosis.
Okay.
It is mild disease. Hospitals are not overwhelmed. We are seeing more than 2,500 cases per day. And still, in the hospital system, this is not Delta for sure. This is not Delta derivative for sure. This is Omicron.
Okay,
and there is a community cluster outbreak in Mumbai for sure. Third wave in Mumbai has started. No question asked.
Third wave in Mumbai has started, but you're saying the symptoms are mild and it's being driven by Omicron.
With the record surge that we're seeing of COVID cases in Mumbai and across Maharashtra, let's run you through all of the guidelines that have been issued by the government so far. First is an advisory to all citizens to be careful, to stay safe and to stay at home to celebrate New Year so that it doesn't turn into some sort of a super spreader. What about the rules that are in place? Well, first, no big parties, no large gatherings are going to be allowed on New Year Eve. There's going to be very strict enforcement on the ground. Closed hall events are allowed, but with 50% of seating capacity so as to ensure that it's not overcrowded and social distancing is maintained. Citizens have been asked again not to crowd in huge numbers at beaches, gardens and streets. At all times, you're going to be seeing police officials there to monitor the situation. Citizens above the age of 60 years and also children below the age of 10 have been asked to stay at home for their own safety, and this has been told by the government to all citizens. Also, they've urged citizens not to go to any famous tourist spots. Don't go to Marine Drive, don't go to Juhu Chowpatty at this time, considering that crowds will tend to gather and build up on New Year's. These are the guidelines that the government has issued. Of course, needless to say, it's upon all of us to ensure that we follow these and much more to ensure we're not hit by a dastardly third wave. Let's take this across now to Mustafa Sheikh. He's joining us live from Mumbai with the latest updates on the story. Mustafa, good morning. You know, in the last few days, what we've seen is an unbelievable surge in cases in Mumbai and thereby across Maharashtra as well. You know, last week itself, you had the government perhaps preempting this, putting forth a number of strict curbs. But despite that, when you're seeing this kind of a surge in cases, is there a possibility that more restrictions will be announced by the government?
Well, the important timing is whether the restrictions will be allowed before the New Year's Eve, which is tomorrow. So yes, Mumbai was the first city to put in place a lot of restrictions for the New Year. The Delhi restrictions, which were stricter, came in later. At that point of time, it was being seen that the Delhi government is being very harsh in putting these restrictions. But yes, the fears, especially in Mumbai, has come through, as Dr. Shashank Joshi was telling us, that the doubling rate is just 4 days. We had reported about 1,000 cases day before yesterday, and yesterday more than 2,500 cases only in Mumbai were reported. Yes, there were 51,000 tests done, but still the positivity rate is about 4%. So it seems like somehow the governments are waiting for the New Year's Eve to pass by without any parties, without any gatherings. But yes, first week of January could see a meeting of the COVID task force in Maharashtra, and more restrictions which were not being assumed just few weeks before are likely in the coming weeks. Back to you.
What should be an eye-opener for every Mumbaiker watching this broadcast is the data of how numbers in a matter of few days has jumped nearly 300% in the city of Mumbai. Mustafa, thank you very much for joining us with all those details. Unfortunately, it isn't just Mumbai, but also the national capital. In Delhi too, we've seen cases doubling. If yesterday I was getting your data of cases inching towards the 500 mark, today it's inching towards the 1,000 mark. The jump in cases, as you see on your screens there, is 86%. 923 cases have been reported in the last 24 hours in Delhi, a steep rise from the number of cases that were detected just a day earlier. The positivity rate thereby has jumped to 1.29%. About 38% of the total samples analyzed at various genome sequencing laboratories in Delhi in the past 1 week have been detected with the Omicron variant, as the city is also witnessing a spike in the cases of Omicron. Delhi so far as Omicron is concerned, has reported a total of 238 cases. There will be fresh numbers that come in about an hour from now. That's when we'll know if in the last 24 hours there have been more cases added to this tally. The Delhi Disaster Management Authority, which is in a wait-and-watch mode, decided not to impose any fresh curbs in the national capital, but continued the yellow alert of the Graded Response Action Plan for some time. A decision on further restrictions will be taken in the next DDMA meeting, after also very importantly monitoring bed occupancy in hospitals. With every passing day, the number of cases in the national capital is going up at a very worrying and alarming rate. But what the Delhi government has also highlighted, and it's very important to talk about this, is that hospitalizations haven't gone up. Let's get you the data right now, how many hospital beds are occupied and how many are still available. At this point, the bed status till December 29 stands at 13,494 available beds. That means that occupied beds at this point is 296. So that you see that the hospitalizations haven't really gone up. What we saw in the second wave perhaps will not repeat now is what experts are saying, because the Omicron variant isn't as severe as the Delta variant. So right now the vacant hospital beds stand at 13,198. Officials are still not leaving anything to chance. They're still ensuring that we're fully prepared in case this blows up into a crisis where hospital beds are required. So as I mentioned, the number of cases in a matter of 24 hours has gone up, almost doubled from what we were reporting just yesterday. Amit Bhardwaj is joining us live from Delhi with the latest updates on the story. Amit, good morning. What are authorities attributing this kind of a surge to? Because very strict curbs have been put in place. Of course, that just came into effect this week. But why are we seeing this kind of a surge? Has there been maybe a lot more testing? Is that what's resulted in these kind of numbers?
Absolutely right. There's a major concern because of this surge, the kind of surge that we are witnessing in the national capital. Yesterday, we had, the COVID-19 numbers touching 500, and today the numbers have almost touched 1,000 mark. And in fact, officials are trying to read the situation, and the initial indications as of now is that the Omicron cases, the samples that were sent for genome sequencing, you see that nearly 38% of the cases are that of the Omicron variant, and possibly that is the reason we are seeing this kind of upsurge. The another aspect that is that needs to be noted right here is that during the DDMA meeting which was held yesterday, in which the Lieutenant Governor, the Chief Minister and the ministers were part of it, the matter was discussed about this sudden surge in the cases, and it was also in a way indicated and accepted that the Omicron cases that Delhi is witnessing, there are chances that there could be community spread as well, because there are many people who have zero, who have not, who have zero international travel history or travel contact at all. So that could be the reason for this sudden upsurge. And if we compare the numbers, while the COVID-19 numbers are touching the 1,000 mark, you also have 238 Omicron cases, and remember that Omicron cases confirming that it's a Omicron variant COVID-19 takes a couple of days.
Okay, so cases are going up, but I'd also like to highlight here that hospitalizations haven't. So while it's spreading very fast, it definitely looks like as of now, these are mild or asymptomatic cases that are being reported. Amit, thank you very much for joining us this morning with all those details.